musculoskeletal conditions of childhood that you need to know, resembling a golf club. So we'll see findings like this foot is turned down and inwards like this, and it's stiff, so it's not easily returned to a normal position. So what do we do for these clients? Well, we need to prepare for serial leg casting soon after birth. This is a series of casts on the foot and leg that will help return that foot over time gradually to a normal position. So for the NCLEX, any client you see with a cast, you need to be worried about two things: skin integrity and, most importantly, neurovascular impairment, because the cast is a hard device that can constrict nerves and blood vessels. So we need to monitor for neurovascular impairment like the 6Ps, including pallor and paralysis. Those need to be reported right away to the healthcare provider. So even after serial casting corrects this condition, we still need to teach the caregivers to perform foot bracing or abduction orthosis to help prevent reoccurrence of this clubfoot. So another condition noticeable straight after birth is developmental dysplasia of the hip. This is when there's an abnormal hip joint leading to instability and dislocation. So because of this hip instability, the femur is actually outside of that hip socket and positioned higher than normal. This causes the affected leg to appear shorter, and we will see asymmetrical thigh skin folds. So one side, the affected side, will have more skin folds than the other. We'll also see positive Ortolani and Barlow maneuvers. These are tests that the provider does to test hip stability in newborns. So what the provider does is they flex the infant's knees towards their chest and then pulls them apart and pushes them back together. If you see any hip dislocation or clicking, that can indicate hip dysplasia. For infants with hip dysplasia, we need to prepare to teach caregivers about Pavlik harness use. This is a device worn to promote that hip stability. So a memory trick, remember the capital H in hip, that is the position that you want those legs. So keep the legs flexed with the hips apart, and that looks like a capital H. So under the harness straps, we need to worry about that skin. So we need to dress them in clothing like a t-shirt and diaper to protect the skin from the rubbing of the straps. We also need to avoid applying lotions or powders because that can cause rubbing and maceration and damage that skin. We also need to massage skin daily to promote circulation. And remember, any client wearing a device, we need to always assess skin integrity and monitor circulation. So for older children and infants with this condition, they will need to undergo a surgical hip reduction and need hip spica casting. Now we're on to a condition mostly discovered in the toddler years. This is Duchenne muscular dystrophy. So this is a genetic disorder causing progressive muscle degeneration and weakness. So when you think dystrophy, I want you to think degeneration. So what do these clients look like? Well, we'll see this classic Gower sign. This is a hallmark sign of Duchenne muscular dystrophy. So we'll see that their legs are so weak that they need to use their hands to rise. So in order to rise from the floor to a standing position, they need to use their hands to walk up their body, something like this. Then, as they begin walking, we will see gait disturbances like waddling and frequent falls from that muscle weakness. This will eventually lead to a loss of ambulation by adolescence. Remember that dystrophy equals muscle degeneration, meaning this is a progressive condition with no cure. So what are these clients at risk for? Well, because they have so much weakness, we're worried about that fall risk. We are also worried because that weakness is in the respiratory muscles as well. So we're worried about respiratory infections also. So our treatment for these clients is mainly supportive. So we give corticosteroids to help delay that muscle degeneration. Because this client's having muscle weakness, we need to teach about the use of assistive devices, things like ambulation aids and wheelchairs. Then we need to promote home fall prevention and do things like removing throw rugs. Remember, they don't just have muscle weakness in their legs, but also in their heart and their respiratory muscles. So we are worried about cardiopulmonary complications like cardiomyopathy. Then we also need to monitor for signs of respiratory infection like cough or fever, because these can be deadly in these clients. So for our first NCLEX quick check, take a moment to answer these questions. What interventions do you anticipate for a child born with club feet? Well, remember, with clubbed feet, we are needing to return that foot to a normal position. So they need to undergo serial leg casting. And remember, any client in a cast, we're worried about two things. That's skin integrity, and very important is that monitoring neurovascular impairment and those 6Ps, things like pallor and paralysis. Then, how does the nurse position an infant's legs in a Pavlik harness? Well, remember that hip or H. It's the shape of the H, so the legs are flexed and thighs abducted or apart. Then, what is the hallmark sign of Duchenne muscular dystrophy? Remember, they are so weak in their legs that they have to literally climb up their legs to a standing position. So that is that Gower sign. So next we're into a condition that appears during the toddler and school age years, and that's juvenile idiopathic arthritis. This is a chronic autoimmune inflammatory disorder affecting the joints. So I want you to think of this as rheumatoid arthritis for kids because the findings and interventions are super similar. So for findings, we will see joint swelling, pain, and stiffness worse after prolonged rest in the morning, just like we would with rheumatoid arthritis. Then we see systemic findings like fever, rash, and uveitis. That is the inflammation of a middle layer of the eye. So for interventions, these are very similar to those for rheumatoid arthritis. We give NSAIDs for joint inflammation like ibuprofen. Then we give disease-modifying antirheumatic drugs or DMARDs like methotrexate to treat that autoimmune condition. So for an exacerbation, what do? We apply compresses and give warm baths to treat that joint pain. Then splinting joints will help reduce the risk of contractures. So for exercise, we need to promote range of motion exercises to reduce that joint stiffness. We also need to encourage low impact activities. Remember, we don't want to put too much pressure on those joints. So things like swimming will help with that. Then activity modifications are needed to reduce that pressure on the joints, like frequent rest breaks. So now for a condition often discovered during adolescence, which is idiopathic scoliosis. That's a lateral curvature of the spine with vertebral rotation. So for findings, we will see a visible curve of the spine where it will look like an S shape like here. Because of that curve in the spine, we will see asymmetry, so it looks like they have uneven shoulders or hips. And if you remember from gym class, they may have asked you to bend over to test for scoliosis. That is because when they bend over, you will see an apparent rib hump due to that spinal curvature. So adolescents are in that Erickson stage of developing a sense of identity. So remember, peer interaction and appearance are really important to these clients. So as nurses, we need to encourage peer interaction and discussions of feelings because they have this obvious alteration of body image due to the spinal curvature. So for moderate curvatures, they will have to wear a scoliosis brace over their torso. And these braces we need to teach are worn to prevent but not correct the curvature. So by now you've probably guessed it. Any client wearing a medical device like a brace or a cast, we're worried about those two things, skin integrity and circulation. So they need to wear a shirt under the brace to protect that skin. Then they need to monitor for skin integrity and circulation regularly. Lastly, if they have a severe spinal curvature, they need a spinal fusion surgery. So during that surgery, major blood vessels can shift and cause compression of the bowel, so we're worried about bowel obstruction. So if we see signs like vomiting or epigastric pain, we need to report those immediately. So our last NCLEX quick check, take a moment to answer these questions. What non-pharmacological interventions help JIA exacerbation? Well, remember, that's like rheumatoid arthritis, so the treatment is similar. We need to apply compresses and give warm baths to reduce that joint pain, and we splint joints to reduce the risk of contractures. Then, which activity is appropriate for clients with JIA, basketball or walking? Well, remember, basketball has a lot of jumping and that can be hard on those joints. So we want low impact activities like walking. The client should not wear anything under the scoliosis brace. True or false? Well, remember, we want to protect that skin under the brace, so we definitely want to wear a shirt. So this is false. Now you know how to master childhood musculoskeletal conditions on the NCLEX. eczema, impetigo, psoriasis? Do you feel itchy yet? Hi, I'm Krista, and today we're diving into the itchiest, flakiest, crustiest, and most common skin conditions you'll see on the NCLEX. Let's dive in. We're starting with eczema, a super common skin condition also known as atopic dermatitis. This is an inflammatory skin condition linked to genetic risk, allergens, and environmental triggers. Remember that because it will come up later. Things like harsh soaps and wool. So what do these clients look like? Well, because it's inflammatory, it causes dry, scaly red patches, like seen here, on the face, the back of the elbows, and the knees. And because it's dry and scaly, it causes intense itching or pruritus. Because eczema causes the skin to get itchy and dry, we need to focus on hydrating and protecting that skin. And that leads us to our first start point that you need to know for the NCLEX, which is apply petroleum-based moisturizers often and immediately after bathing. Why after bathing? Because right after bathing, the skin is damp. And if we apply moisturizer, it can lock in that moisture and prevent dryness. Then we give antihistamines because that helps treat that itch, and we give topical steroids to decrease inflammation, things like hydrocortisone. Next, we need to prevent flare-ups because this is triggered by those environmental factors and infections from scratching. So we do this by avoiding those triggers that irritate the skin, things like wool, which are scratchy, fabric softeners, and harsh soaps. Instead, we want to recommend soft, lightweight clothing that doesn't cause itching. Because scratching can lead to opening lesions and infection, we want to keep those fingernails short and clean to prevent infection and apply gloves to prevent scratching altogether. Next, we monitor for skin infections from that scratching, things like impetigo. So to recap, if you get a client with eczema, I want you to think of two things: hydration and protection, both from those itchy environmental triggers and from scratching. Scratching of those eczema lesions can lead to a bacterial infection like impetigo, which is our next condition. This is a highly contagious bacterial skin infection, often developed secondary to skin infections like eczema. This is more common in children, and we will see hallmark findings like these vesicles that rupture and form honey-colored crests around the mouth and nose. So if we put together these honey-colored crests in children who like to touch their face and everything else, well, that's a recipe for spread of infection. So our focus is infection control. So when the NCLEX asks you what kind of isolation precautions for a client with impetigo, I want you to think contact, that gown and gloves, because of those honey-colored crests. I want you to also teach infection control with proper hand washing and avoiding sharing personal items like towels and utensils, because you know kids love to share. We tell caregivers to gently wash lesions and remove those crests. Why? Because removing them can more easily allow topical medications to be absorbed. So what kind of medications we give? Well, because this is a bacterial infection, we give antibiotics. We give topical, oral, or IV antibiotics like mupirocin. So to review, when you think of impetigo, think of those honey-colored crests. Prioritize using contact isolations for these clients and teaching infection control. No sharing of those personal items. So this is our first NCLEX quick check. Take a moment to answer. When should a client with eczema apply moisturizer? Well, they should apply petroleum-based moisturizers often and immediately after bathing. Why? Because the skin is damp, and when we moisturize, it can help lock in that moisture and prevent dryness. What should a client with impetigo avoid? Well, remember, that's that crusty bacterial infection that spreads really fast. So we need to avoid sharing personal items with others like towels and utensils. We're going from a bacterial infection to something fungal known as candidiasis. And what do fungus love? Well, they love warm, moist areas. So candidiasis is a fungal infection affecting warm, moist areas like the diaper region, mouth, and vagina. This most commonly affects clients with decreased immunity, like those with AIDS or those undergoing chemotherapy. What does candidiasis look like? Well, it depends on where it affects the body. In the diaper area, it looks like this, and we see moist red patches. In the oral area, it's known as thrush, and this causes these white adherent plaques on the tongue that are not easily scraped off. In the vagina, it's called a yeast infection, and it causes this intense pruritus and white lumpy cottage cheese discharge. So because this is a problem of too much moisture, we need to avoid prolonged exposure to moisture. And how do we do this as nurses? Well, we promptly change wet clothes, diapers, and bedding. We also need to dry skin between skin folds after bathing because fungus love to grow in those moist, warm crevices like under the armpits and in the groin. We also need to teach clients to avoid wearing tight clothing, which can trap moisture and warmth. We also tell them to rinse the mouth after taking inhaled corticosteroids to prevent that thrush. In addition, we need to treat that fungal infection and the underlying cause. So we need to keep the skin dry and clean to prevent further fungal growth. We also need to administer antifungal medications, things like nystatin. So remember, candidiasis is a fungal infection. So we treat it with antifungal medications and we keep that skin clean and dry. We dry wet areas immediately. So this is our next quick check. Take a moment to answer. After bathing a client, what can the nurse do to prevent candidiasis? Well, remember, candidiasis loves those dark, warm, moist areas. So we need to dry skin between skin folds, under the armpits, and in the groin. So not all skin conditions are infectious. Let's talk about a condition that's very similar to eczema because it's also inflammatory, known as psoriasis. Psoriasis is a chronic inflammatory autoimmune condition that causes rapid skin cell buildup that leads to skin plaques, and this is worsened by triggers. So for findings, these clients will have these thick, silvery scales on red plaques, and these appear at the elbows, knees, and scalp. So interventions for this are very similar to eczema. We apply moisturizer to prevent pruritus on those silvery scales and plaques. We avoid triggers like stress that can worsen that skin cell buildup. And we use topical and oral medications. We give corticosteroids to help decrease inflammation. We give salicylic acid to help break down those plaques. And we give immunosuppressants to treat that autoimmune condition. So to review psoriasis, it causes those silvery scales on red plaques. We need to moisturize and apply topical and systemic medications to prevent that skin cell buildup. So from a dry skin condition back to moisture, we're dealing with clogged pores and a condition many people have suffered from, acne vulgaris. This is an inflammatory skin condition that's caused by hormonal changes like puberty, excess sebum, and or bacteria. So findings, we will see comedones, those whiteheads and blackheads, those papules, and those pustules like we see here. And these most often appear on the face, chest, and back. Because this condition is caused by oil buildup and clogged pores, we need to promote cleansing of that skin 1 to 2 times a day and washing hair regularly to prevent that oil buildup. Then we need to administer oral and topical medications, things like benzoyl peroxide and retinoids. But remember, with these topical acne medications, it causes photosensitivity when outside. So we need to encourage daily sunscreen use to protect that skin. When the client sees all these pimples on their face, they are really tempted to pop them. So if on the NCLEX, a client asks you, "Can I pop my pimples?" What do you say? You say no. We want to teach clients to avoid any kind of vigorous scrubbing, picking, or squeezing of these lesions. That can lead to scarring and even a skin infection. We want to also have them avoid oil-based products and use non-comedogenic products that don't clog those pores. So to review, for acne, we want to prevent that oil buildup and protect the skin. They do this by gently cleansing the skin, no scrubbing, and no squeezing those pimples. For our last quick check, take a moment to answer. What is a key finding in clients with psoriasis? Well, remember, that causes that rapid skin buildup and those plaques. So this causes those thick, silvery scales on red plaques at the elbows, knees, and scalp. What should clients with acne vulgaris avoid? Well, remember, we want to prevent that oil buildup and protect that skin. So we need to avoid oil-based products and no vigorous scrubbing, picking, or squeezing of those lesions. Hopefully, you've been able to scratch that itch for common skin infections, and now you can master them for your NCLEX. A healthy heart pumps red, oxygen-rich blood, but when something goes wrong with the heart at birth, these babies can literally turn blue. Let's break down congenital heart defects for the NCLEX. So let's go over normal blood flow through the heart. So it goes through